Welcome to Adverse Childhood Experiences, or ACEs, study, an integrative technology project by Alexis Gautreaux and Melissa Brown. Upon completion of the presentation, the viewer should be able to determine the purpose of the ACE study, identify what events qualify as an ACE, recognize the risk factors associated with ACEs, and recognize preventative factors for complications related to ACEs. To test your pre-presentation knowledge, we will now present 4 pre-test questions. After the presentation is complete, we will review the answers during the post-test. Number 1, what are the 3 categories of ACEs? A, emotional, physical, and verbal. B, primary, secondary, and tertiary. C, abuse, neglect, and household dysfunction. Or D, minor, major, and severe. Question number 2. What population is at an increased risk of experiencing a higher number of ACEs? A, older adults living in a rural area. B, college students living on campus. C, minorities and women. Or D, males in the military. Question number 3. Outcomes associated with ACEs include all of the following except dangerous health behaviors such as smoking, substance misuse, or risky sexual behavior. B, chronic health conditions such as cancer, obesity, and stroke. C, poor social outcomes such as unemployment, lower levels of education, and lack of health insurance. Or D, stable relationships, smart financial decisions, and active participation in community projects. Question number 4. All of the following are protective factors except A, healthy development of social and emotional competencies. B, living an active lifestyle that includes 30 minutes of exercise 5 days a week. C, positive relationships. D, safe, protective, and equitable environments. The study that we'll be looking at today is the CDC Kaiser ACEs study. The purpose of this study was to investigate how childhood abuse, neglect, and other forms of trauma affect health and well-being later in life. It was conducted by Kaiser Permanente and the CDC from the years 1995 to 1997. All of the participants were given physical exams as well as questionnaires so that they could collect data on childhood experiences and current health status. It was one of the most extensive studies of childhood adversity and its long-term effects, with over 17,000 participants. They found that exposure to childhood events increases the risk of unfavorable physical, behavioral, and mental health outcomes. So what exactly is an ACE, or an adverse childhood experience? According to the CDC, there are 10 types of ACEs, and they typically are arranged in 3 separate categories. Category 1 is abuse, and under this category, it contains physical, emotional, as well as sexual abuse. Now, category 2 is neglect, physical neglect and emotional neglect. And then the third category is household dysfunction, which can include mental illness, domestic violence, incarcerated immediate relatives or being in an environment of crime, substance abuse, and divorce or parental separation. So how prevalent are ACEs? Of 25 surveyed states, 61% of adults experienced at least one ACE before the age of 18. Also, 16% of adults experienced 4 or more types of ACEs before age 18. The CDC states that minorities and women are at increased risk for experiencing a higher number of ACEs. And then we have the ACEs that are ranked by prevalence. So the most prevalent ACE is physical abuse, followed by substance abuse in the home, parental separation or divorce, sexual abuse, mental illness, emotional neglect, domestic violence, emotional abuse, physical neglect, and crime or incarcerated relative. So now we're going to look at how to evaluate ACEs. The ACE survey is a yes or no survey that inquires about the occurrence of different categories of ACEs before the age of 18. The number of yes answers is added to calculate the ACE score. For example, a score of 1 means that 1 out of the 10 previously listed categories was reported. There is a dose-response reaction. The higher the score, the higher risk of undesirable outcomes.
Learning to deal with stress is an important part of healthy development. When experiencing stress, the stress response system is activated. The body and brain go on alert. There's an adrenaline rush, increased heart rate, and an increase in stress hormone levels. When the stress is relieved after a short time, or a young child receives support from caring adults, the stress response winds down and the body quickly returns to normal. In severe situations, such as ongoing abuse and neglect, where there is no caring adult to act as a buffer against the stress response stays activated. Even when there is no apparent physical harm, the extended absence of response from adults can activate the stress response system. Constant activation of the stress response overloads developing systems, with serious, lifelong consequences for the child. This is known as toxic stress. Over time, this results in a stress response system set permanently on high alert. In the areas of the brain dedicated to learning and reasoning, the neural connections that comprise brain architecture are weaker and fewer in number. Science shows that the prolonged activation of stress hormones in early childhood can actually reduce neural connections in these important areas of the brain at just the time when they should be growing new ones. Toxic stress can be avoided if we ensure that the environments in which children grow and develop are nurturing, stable, and engaging.
Toxic stress results from prolonged and excessive activation of the stress response systems. Chronic stress causes damage to the body and the brain, which has been associated with unfavorable health outcomes. Children are especially susceptible to the damaging effects of this stress related to the plasticity of their developing brains. When we look at the outcomes associated with ACEs, we can see that ACEs can lead to several poor outcomes, such as development of chronic health conditions, such as coronary heart disease, stroke, asthma, COPD, cancer, kidney disease, diabetes, as well as obesity, as well as mental health conditions such as depression. And it can also increase a person's likelihood of developing health risk behaviors such as smoking, heavy drinking or alcoholism, substance misuse, physical inactivity, risky sexual behavior, as well as suicidal thoughts and behavior. And it's also been shown to lead to poor social outcomes, such as lack of health insurance, unemployment, and less than high school diploma or equivalent education. And the research has shown that experiencing a higher number of ACEs is associated with many of the leading causes of death. If a person scores 4 or more on their ACEs survey, their likelihood of developing chronic pulmonary lung disease is increased by 390%. Their likelihood of developing hepatitis is increased by 240%. Depression is increased by 460%, and they are 1,220% more likely to attempt suicide. So, how do we combat ACEs? 2 things to think about are resilience and protective factors. Resilience is defined as the ability to cope with adversity and adapt to challenges through personal attributes and access to social and cultural resources. Resilience is built, and the long-term effects of toxic stress can be prevented when protective factors are in place. 3 categories of protective factors that the most commonly used frameworks are based on are positive relationships, safe, protective, and equitable environments, and healthy development of social and emotional competencies. Here are some common frameworks for protective factors. Children's Bureau Administration on Children, Youth, and Families Protective Factors Framework. Center for the Developing Child, Harvard University's Factors that Predispose Children to Positive Outcomes Framework. Center for the Study of Social Policies, Strengthening Families, a Protective Factors Framework. Center for the Study of Social Policies, Youth Thrive. And Centers for Disease Control and Prevention's Essentials for Childhood Framework. There are some limitations to be aware of in these common frameworks. Many of them do provide specific instructions on how to implement the protective factors, but each framework focuses solely on a specific population level, such as individual, family, community. But none of the frameworks address protective factors across all the levels. And also we found that none of the frameworks addressed health equity or disparities regarding access to care. Now let's take a look at the barriers to treatment as well as the implications for the advanced practice nurse. Prevention through the implementation of protective factors is the most effective strategy regarding ACEs, but unfortunately there's really significant deficiencies in evidence on interventions after ACEs have occurred. So the most substantial evidence exists for cognitive behavioral therapy for those who have been exposed to abuse. Other interventions include parent training and broader support community intervention. Although these interventions have some favorable research findings, overall efficacy is inconclusive. The nursing learning theory that we utilized in this project was Benner's model of skill acquisition. Knowledge development is important to providing effective nursing. And Benner really focused on going from a novice to an expert. It includes 5 levels of nursing practice: novice, advanced, beginner, competent, proficient, and then finally expert. And as you can see by this graphic, we all can start as a novice and advance, and we grow and grow and grow into the expert as we acquire skills and knowledge. So our purpose for this presentation was to help people go from a novice on the subject of ACEs to maybe an advanced beginner and spark the desire to continue to learn about it to become one day proficient or expert on the subject. Now let's take our post-test. Question number 1. What are the 3 categories of ACEs? A, emotional, physical, and verbal. B, primary, secondary, and tertiary. C, abuse, neglect, and household dysfunction. Or D, minor, major, and severe. And of course, our answer is C, abuse, neglect, and household dysfunction. Question number 2. What population is at an increased risk of experiencing a higher number of ACEs? Would it be A, older adults living in a rural area, B, college students living on campus, C, minorities and women, or D, males in the military? And our answer is C, minorities and women. Question 3. Outcomes associated with ACEs include all of the following except A, dangerous health behaviors such as smoking, substance misuse, or risky sexual behavior. B, chronic health conditions such as cancer, obesity, and stroke. C, poor social outcomes such as unemployment, lower levels of education, and lack of health insurance. Or D, stable relationships, smart financial decisions, and active participation in community projects. And the answer is D, stable relationships, smart financial decisions, and active participation in community projects. Question 4. All of the following are protective factors except A, healthy development of social and emotional competencies, B, living an active lifestyle that includes 30 minutes of exercise 5 days a week, C, positive relationships, or D, safe, protective, and equitable environments. The answer is B, living an active lifestyle that includes 30 minutes of exercise 5 days a week. This concludes our presentation on the ACEs study. We appreciate your attention and hope that you have learned something valuable today.